The reason it's important to tell a personal story as well as giving data is that people are more motivated, more hooked by a personal story than they are by all the wonky data in the world.
Several times per year at least, I would see a patient that had missed their follow-up visits for a year and came in and would tell me that they lost their insurance when they lost their job. And they struggled during that time to control their blood glucose. And so they would come back in once they got reemployed, higher hemoglobin A1C, maybe albumin in the urine, maybe retinopathy after that year lapse in care. So it's this perverted system we have of medications and insurance tied to employment. It's very hard to take care of people with chronic conditions like type 1 diabetes, and it's so frustrating.
I was taking care of a patient who'd had a breakthrough seizure while driving. Because he had had a breakthrough seizure, based on the laws in that state, was unable to drive for 6 months. He can't be on his medications without insurance, but he can't be on insurance if he can't work, and can't get a job if he's not on his medications. And it's this really stupid, infuriating cycle.
The state of Kentucky approved the Hib vaccine for the Medicaid population immediately. Private insurance companies drag their feet. This is the Humanas, Aetnas, Blue Cross Blue Shield for 6 months. And during that period of time, I had several families insured who told me that they could not afford to pay for the vaccine out of pocket. I had 2 patients during that 6-month window, both insured, both from families who couldn't afford to pay for the vaccine out of pocket, who developed H-flu meningitis, both of whom had significant morbidity as a result of their infection. It's furious, just furious.